Good morning, guys. I hope we're all sparkly. I've been told to do a video, so, here we are. Let's do a video because the real boss has instructed me and I must obey. Now, why do men need women and why do women need men? Because according to the feminists, men are superfluous. We're no longer necessary, but clearly we are. So why is it? Well, let's break it down hormonally, because that's what this is about. Hormones. Hormones, the foundation of life. So men, testosterone dominant, which means dopamine dominant, which means reward driven logic. Women, estradiol dominant, which means serotonin, which means happiness, emotions. So why do we need men and why do we need women? Because it's all about what? That favourite word at the men's health clinic. Balance, baby. Because with testosterone comes estradiol. Because testosterone converts into estradiol via the aromatase enzyme. Located in numerous tissues, the two tissues that you can directly impact how much testosterone gets converted to estradiol are the liver and body fat. So what am I going to say? Eat clean, train hard, do all the things that you know you should be doing. Stop poisoning yourself with poisons. So, why do we need estradiol? Because if we're testosterone dominant and we're reward driven, we need balance, baby. Because we need to be considered. We need empathy. We need the feminine. Masculine versus feminine. Now, we're more masculine. Hopefully. But we need to be considered in the community. We can't be so bullish. You know the guys on gear. They're good fun for 10 minutes, but they're not considered. They're not balanced. They're not objective. And we need a level of objectivity to counterbalance our masculine. So the feminine, we need a bit of feminine. Guys on testosterone replacement therapy. My word, when they first get their testosterone and their estradiol raises, they are a bit feminine. Why is that? Because we're not good at dealing with our emotions. Now we get anxious, we get emotional, and we're not used to it, so we're uncomfortable, and we reach out for help. Understanding that actually it's all about balance, and that process takes time. It's not a quick fix. We're an evolution of work, a work in progress. So yeah, why do women need men then? Because they're so happy and confident now because they need the masculine. So women have actually, very interestingly, more testosterone than they have estradiol, because testosterone sits above estradiol in the steroidogenesis pathway. So obviously most of their estradiol is made by the ovaries, but also the adrenal glands. So again, it's all about what? Yeah, that concept of balance. So yeah, women are more estradiol dominant, which means serotonin dominant, which means comfort. And we are expendable. Now, we're important, obviously. But yeah, women are perhaps more important than men. Does that mean we should just all go? No, it means that we should make ourselves important. How do we make ourselves important? By finding value, finding meaning, finding purpose. And ultimately, that's all down to you. It's not down to me, it's not down to her. But yeah, listen. We're supposed to provide. We are supposed to protect. We're not expendable. We're not going to let ourselves be expendable. So we're going to find purpose and meaning, because what's it all about? It's about the journey, the appreciation of the moment, but being considered for the past and considerate of the future. What do I want to be? I want to be the best version of myself. Yeah, I do. But I keep messing up because I'm ultimately very self-destructive. Why? Because we've reached that destination. That destination is what? Safety. We're not supposed to reach the destination of safety, and it's not supposed to be a constant. So in this modern civilized world, what do? We take risks. Why do we take risks? Because we still got those drives, the innate drives within us that crave danger. So you can do that considered. You can be lifting weights, you can go hiking, or you can engage in negative behaviors like taking drugs, drinking alcohol, gambling, womanizing, being a naughty boy. And being a naughty boy is what? Well, it's fun, isn't it? but ultimately it can be dangerous, and ultimately it can cause to your demise, and we don't want that. So we want to have calculated risks, and we talk about testosterone being the calming hormone, but the internet talks about it being roid ragey, but it's not. Now, testosterone is the counterbalance to cortisol. What's it all about? Yin yang, baby. Cortisol, your stress hormone. So when you are faced with a stressor, your catecholamines, your excitatory neurotransmitters are firing. What do I need to do? Do I need to fight or do I need to flight? So what am I going to do? Well, if it takes time, cortisol is going to take over. And what's that going to happen? What's going to happen? What's going to happen? Now, you need a considered reaction to the situation. So the counterbalance of these excitatory neurotransmitters and cortisol is what? Your parasympathetic nervous system, the calming part of your nervous system, and what? Testosterone. So whilst we might think that testosterone is this alpha male hormone that's going to make you aggressive, it's not at all. Now, we said about the testosterone versus estradiol comment, we need to be considered, which is why we need the estradiol, but we need the testosterone, the counterbalance. So ultimately, what's it about? Having a considered reaction or considered response to a stressor. Now, how are you as a human being going to manipulate it? Through manipulating the parasympathetic nervous system. And how are you going to do that? Through breath. What does our society do? It does it through eating, comfort eating. Comfort eating will ultimately do what? Dysregulate your physiology. And you will get no comfort from dysregulated physiology. You'll get into a pro-inflammatory state. And again, we talk about the bodybuilders and they're eating constantly to be anabolic. But it's a pro-inflammatory state. We need stressors. We need periods of starvation, then periods of comfort. Yin, yang. The passage of time keeps going and going and going. So you have to help facilitate that. How? By looking at your stressors, addressing your stressors, addressing your sleep, addressing your nutrition, addressing your exercise, addressing your mindset. How often? All the time. All the time. You need to be on point all the time. Foot to the floor. No, not always foot to the floor. You have to understand, again, the concept of balance. But you shouldn't take it easy. You shouldn't become complacent. With complacency, you get contempt and you will ultimately cause harm and end up in this situation. Because low testosterone is a cascade of wrongdoings. You were given thousands, tens of thousands of chances to do the right thing. So you went out and got blitzed at the weekend. Great fun. Yeah, night out with the lads. It is great fun, obviously. That's why you do it. But you felt rubbish on Sunday. You felt rubbish on Monday. But by Friday, you felt great again. So I can do it again. So consciousness adds a complexity to the human experience of survival. And it's not always a positive thing. So we should be constantly learning. And as Carl Jung said, in the first 40 years of life, you're developing a healthy ego. In the second 40, you're looking inwards to get rid of it, because then you go, now I understand. Now, are you supposed to understand fully? No, you're not, because again, it's all about exploration, continued learning. And if it wasn't about continued learning and evolving, what would be the point? Well, you've reached the destination. So what's left? There's nothing left. So it is a journey of self-exploration. But fundamentally, you have to understand your physiology. You can't outthink your physiology. With that base of testosterone, you can have a considered reaction. You can allow that breath to effectively help you in a stressful situation. If you've been exposed to so much stress that you are ultimately confused, anxious, and disappointedly sometimes suicidal, it's going to be a hard journey, but it's your journey to take. And again, another quote, Winston Churchill, if you're going through hell, keep going. Ultimately, you are responsible and accountable for your actions. So start making the right choices, being considered with that testosterone, normal testosterone, not high testosterone, normal testosterone, because the counterbalance is what? Cortisol. Now, we don't want too much testosterone because we know it causes harm. raised hematocrit, blood pressure, lipid dysregulation, poor sleep. Sleep is restorative. If you get bad sleep, you're in trouble. Psychological problems, again, too much testosterone, too much focus. We need to be considered. So men, we need women. Women need men. Make yourself important. Be valued. If you're not valued by somebody else, have internal value. I am doing the right thing. Be considered, be considerate, and do what? Yeah, you guessed it. Go earn your reward.